Nowadays, we can notice many of the children having problem in acquiring academic skills. Is all this problem is intellectual disability or learning disability? Let's learn. Myself Sukumiii, I am the student of occupational therapy. How we diagnose learning disability and intellectual disability? We have some criteria. 4 criteria for learning disability and 3 criteria for intellectual disability. Let's start with learning disability. First criteria, difficulties learning and using academic skills. I am going to tell 6 symptoms. In these, at least one symptom should be persisted for 6 months. Then only we can confirm learning disability. First, inaccurate, slow or effortful reading. Example, stethoscope is read, then meaning is not understood by the person even after 6 months. Even we are not know the meaning once we read stethoscope. But after 6 months we can notice that is a material, a device. So this child can't learn even after 6 months. Next, difficulty with spelling. Yes, we are also do mistake in spelling. Stethoscope, first time, second time, third time. This person is doing mistake continuously for 6 months. That is the problem. Next, difficulties with written expression. What are the expression? Grammatical expression, punctuation, comma, quotation. These things are all the person is continuously mistaken for at least 6 months. Even within one sentence, he can do multiple grammatical mistake, multiple punctuation mistake. In written form, there is an idea is delivered, so he can't able to deliver the idea by written way. Next symptom, difficulty in mastering the number fact, number sense, and mathematical calculations are all difficulties. Yes, we are all also not understand the calculation by first time. Continuously for 4 times, 5 times we can understand. But this child for even 6 months he can't understand what the mathematical calculations are going. Next, difficulty with mathematical reasoning. The application of procedure in the problem, mathematical problem. We have to apply correct procedure for the correct problem. That application knowledge can't be learned by this child even for 6 months. In these symptoms, at least one symptom should be persisted for at least 6 months in this child. It's the first criteria. Second criteria, the affected academic skill should be quantifiably below the chronological age of the child, which means stethoscope can be written in age 8, but the child in age 10 can't able to written, then it is come under the learning disability. These skill interference in academic performance, occupational performance, and activities of daily living. How we measure the skill is useful for the activities of daily living. We use standardized measures and clinical assessments and all. So this is the second criteria. It should be below the chronological age and it should affect the ADL and academic performance or occupational performance. Then third criteria, the learning difficulty begin in the years of school age. That academic skill should not exceed the capacity of the child. Example, the child can read small word along the 2 pages. Example, it has 3000 letters. Then how the child can read it? It's not possible. So it can't exceed the child capacity. This is third criteria. We should consider the child capacity and skill. Fourth criteria, it should not be explained by any other condition like intellectual disability or visual acuity problem, auditory problem, or any other psychological problem, mental problem. In any disorder, it should not be explained. That is the fourth criteria. The child meets these 4 criteria, then the child has learning disability. Then what about intellectual disability? Let's start. First criteria, low IQ. What is IQ? Intellectual quotient. For genius, it may be higher. For mental retarded or intellectual disability people, it below the 70. We should administer IQ test to qualify the IQ level. Then the child have problem in adaptive functioning. What is adaptive functioning? How the child handle the demands. Many more demands are present in nowadays. So example, I tell some of the demands. In these, at least 2 of the demands should not meet by the child. Then it is comes under intellectual disability. Communication, self-care, home living, social skill, interpersonal skills, self-direction, work, leisure, educational, academic skills, health, safety, use of community resources. In these adaptive functioning, any two of the adaptive functioning can't be handled by the child. Then the child have intellectual disability. This is the second criteria. Third criteria, the onset is before 18 years. The child should not met 18 years during the onset. Then it is the intellectual disability. In both disabilities, the child can't able to learn. In learning disability, the child can't able to learn because the ability problem. In intellectual disability, the child can't able to learn because the intelligence problem. So the child can't able to learn in these both cases. But in learning disability, specific area is affected. Example, academic area. But in intellectual disability, adaptive functioning also affected. Self-care, so social skills, interpersonal skills, these are the self-adaptive functioning. These are all affected in the intellectual disability. In both learning disability and the intellectual disability has gradation mild, moderate and severe level. 85% of the intellectual disability cases are all mild only. So only 10% is severe cases and 5% are moderate cases. We can notice learning disability alone, but we can notice intellectual disability with other syndromes like Down syndrome, Klinefelter syndrome. Intellectual disability is combined with a genetic. Chromosomal disorders are also combined with intellectual disability. For these two problems, we should collaborate with the teacher, parents, and colleagues of the child to improve the psychoeducational therapies, and we can make the child become normal. So in this video, I explained learning disability and intellectual disability and their differences and their relations. In next videos, we can furtherly discuss more conditions and discuss the intervention techniques. Thanks for watching. I need your support. Please subscribe. Thank you. Tata.